Hi class, my name is Claire and today I'm going to talk to you about polycystic kidney disease. So polycystic kidney disease, or PKD, is, well, how it sounds. It's when you develop multiple cysts, fluid-filled cysts inside of your kidneys, and it can seriously inhibit your kidneys' function and even cause kidney failure in about 50% of all cases. So according to kidney.org, there are 600,000 people in the United States with polycystic kidney disease, and it's the fourth major cause of kidney failure. Interestingly enough, though, the severity of the symptoms severely fluctuates between patients. There are some people that don't experience symptoms and are fine their entire lives, and then there are people that ultimately have to get a kidney transplant. So there are three different types of polycystic kidney disease. There's autosomal dominant PKD, autosomal recessive PKD, and acquired cystic kidney disease. So for this presentation, I'm going to mainly focus on autosomal dominant polycystic kidney disease, or ADPKD, because it's the most common form. About 90% of all PKD cases is the ADPKD. And it's also what's affecting my family. So autosomal dominant polycystic kidney disease is when it's passed down through inherited dominance, or dominant inheritance, my bad. So the symptoms don't usually start showing up until your 30s to 40s, but it can occur in younger people and even children. So speaking of the symptoms, some things you can look out for is blood in your urine. That's a big one. Pain in your back and sides. UTIs, kidney infections, bladder infections, and the biggest one is high blood pressure, which is the most common of all of the symptoms and probably the most severe. You can also experience headaches and kidney stones. So with that being said, diagnosis usually consists of ultrasounds. They're the most common form of diagnosis. However, if the kidneys or if the cysts are really small, there's also CT scans and MRIs that are used. As far as a cure, unfortunately, there is not one, but there are preventative measures you can take if you have been diagnosed with PKD to ensure that the cysts stay small and don't affect your kidney's function. So you can exercise moderately, you can drink lots of water, avoid caffeine, avoid alcohol, have a low sodium diet, monitor your blood pressure, which is really important. Maintain a healthy weight, and just overall treat your body well to inhibit the loss of kidney function. So along with that, the people that are severely affected by PKD that have either had to have their kidneys removed or have almost completely lost all of the function in their kidneys, they have to go through dialysis, which is basically makes up for that loss of function. So it cleans your blood and removes your toxins. My dad had to go to dialysis 4 days a week for 4 hours a day, and he did it for 2 years. And then comes the transplant process, which is not easy in any organ situation. There's lots of strict criteria that you have to make sure, the donor and the recipient have. It's a difficult process and it's a long process. You can be on the list for years. Like I previously stated, my dad was in dialysis for 2 years, so he didn't get a kidney for 2 years. And then after you get the transplant, life's not so easy either, because you have to take anti-rejection medicine for every day for the rest of your life. And you have to avoid places with crowds and buffets because your immune system is majorly compromised. So, lastly, what I wanted to talk about is my experience with PKD and my family. My grandpa had PKD, my uncle, my aunt, two of my cousins, and my dad. My grandpa and my dad were probably my dad was the most impacted, but they both had to get kidney transplants, and everyone else in my family has somewhat been affected. And it is a 50% chance that someone who has PKD will transfer that to each of their children. It's a 50% chance. So I, for one, hope I don't have it because I don't do needles and I could not sit still for 4 hours a day, for 4 hours for 4 days a week. But thank you for listening to my presentation, and I hope you all have a wonderful day. Thank you.